Good afternoon once again. Today is Thursday, May the 21st, 2020, and this is the daily press briefing here at the CCSA. First of all, the spokesperson, in ending his briefing, mentioned about wearing masks, wherein the appropriate way, of course, of wearing masks is that the top part of the mask has to be placed fitting on the top of your nose and not fall down. It has to cover the nose as well, in summary. So that's very important. And he also emphasized that working from home, as well as staggered working time, is still very important, is still relevant. If that can still be implemented, that's very important for the maintenance of hygiene, for the prevention of any spread of COVID. So 5 days or so have passed since we entered into the second phase, and many measures have been relaxed in terms of business establishments. We'd like to thank the public, of course, Thai and foreign citizens living in Thailand, for your cooperation, patience, and understanding. So we therefore must continue to take caution and not take the improving situation for granted by becoming too complacent. Of course, we continue wearing masks, washing hands frequently, and maintaining social distance. And if you have to go outside, of course, we all know now about the ituation platform to check in and check out of business establishments that you visit. This is an important tool for public health, created for the benefit of everyone in Thailand. Its purpose is merely to ensure that there is no further spread of COVID in the public domain. And those who may be at risk will be informed of the unlikely situation of infection if that happens. So we have coming up for you a slide on the statistics of the ituation platform to date. So far, 73,295 business establishments have registered themselves to use the platform. A total of more than 6.3 million individual users around the country, having checked in around over 11.5 million times, and checking out of business establishments around 8.6 million times. Upon leaving the platform, the customers will be able to evaluate the business establishments, and the around 5 million evaluation has been completed. The overall result is quite satisfactory in terms of evaluating the various measures of the businesses. So moving on to the general situation in Thailand, we have recorded for you today 3 new confirmed cases, making the cumulative number of cases 3,037, with recoveries numbering 2,897. As you can see, obviously the numbers are closing up on each other, and the number of recoveries and discharged persons is about to meet with the total number of cases in Thailand, with 0 fatalities. The 3 new confirmed cases, we'll be giving you some details on this, as the spokesperson had summarized. The first is a Thai male, aged 72 years old, living in Bangkok, already suffering from lung cancer and diabetes, and he started to have symptoms of fever and coughing on the 18th of May, 2020. The second case is a German male, 42 years old, living in Bangkok, and he was asymptomatic. No symptoms showed. He visited relatives in Chayapum province during the first half of May, and after returning to Bangkok, he went for a health checkup for employment on the 18th of May and was found to be infected positive with COVID. The third case is a Thai female, aged 25 years old, who was a language student returning on a repatriation flight from the Philippines, and she was also asymptomatic and returned to Thailand on the 13th of May, found to be infected on the 19th of May, not over the 14-day while she was in state quarantine. The spokesperson also emphasized the importance of using the ituation platform as a means to trace the history of places that people have visited. If found later that an infected person was in the same place as and time as your visit, the platform will send you a message through the phone number you use to check in and check out of that place. Of course, there were recurring questions about the maintaining of that data, the phone number you used to register, the maintaining of that data for 60 days. But after 60 days, of course, the data will be deleted. And why 60 days? Because oftentimes the 14-day period will continue for around, we have to trace back for around four times, meaning four generations of infections. So 14 times 4 is approximately 2 months or 60 days. So if there was a case of infection, it's very important to trace back 4 generations back on where the infection came from. So that's the reasoning, and of course the data will be deleted within 60 days. On the issue of the compliance measures and the inspection statistics, we have for you a slide, an English language slide coming up on screen for you, wherein the sites inspected, recorded as of yesterday, was around over 21,000 business establishments. And those who have not fully complied with the measures numbered around 31. And of course, we will be updating this every day in the various business clusters and hoping that all businesses will fully comply with the 5 basic principles, with the specific criteria for each business type and establishment. That's very important. So hoping that we will get full compliance in due course. And of course, as mentioned earlier, there are various interdisciplinary teams that have gone out on site to visit business establishments across the country on a daily basis. On the issue of Thai nationals' repatriation, we have continuing repatriation flights, as the spokesperson mentioned. We'll be showing that to you perhaps once a week, but of course, we have various flights coming in from countries and territories around the world as usual to repatriate Thai nationals back. In the meanwhile, the Thai embassies continue to take care of Thai citizens before they return on these repatriation flights. So we have an image for you on screen. This is on the 19th of May, 2 days ago. The Thai embassy in Santiago, Chile, helped arrange the repatriation flight of 6 nationals. They actually had a long journey, traveling halfway around the world, about 26 hours from Santiago, transiting in Sydney, Australia, before arriving in Bangkok yesterday afternoon. We also have an image from the Royal Thai Embassy in Riyadh, Saudi Arabia, and Team Thailand in Saudi Arabia, who sent off around 40 Thai nationals from a flight from Riyadh to Kuala Lumpur, Malaysia. And since this was a chartered special flight arranged by the government of Malaysia to take Malaysian nationals home, we would like to take this opportunity to express our thanks to the Malaysians for their generosity, as well as the display of good friendship and neighborliness as fellow members of the ASEAN family by allowing Thai nationals to board this flight. And after arriving in Kuala Lumpur, the Thai embassy in Kuala Lumpur took over the responsibility to transport these Thai nationals to the Thai-Malaysian border this morning. Yes, we have to remind you, of course, of the importance of the measures that are in place to continue. It's like we're almost there. We're almost at the end of the race, just to make a comparison. But of course, we have to complete it 100%. It will be such a pity that if we have any faults or if we put our guard down, and of course the numbers come back, that would be very pitiful for all of us, and our efforts would have come to waste. So hoping that we will continue on with this strength together. One issue which I'd like to recap, which was mentioned by the spokesperson as well today and in the past days, is the issue of locally produced vaccine. So just to expand a bit more on that today, on the 19th of May, Dr. Suwit Mesinsi, the Minister of Higher Education, Science, Research and Development, revealed that a research conducted jointly by Chulalongkorn University, the National Vaccine Institute, and the Department of Medical Sciences of the Public Health Ministry yielded a success on vaccine experiment with animals. And an initial test at the University of Pennsylvania in the United States resulted in a boost of immunity at a higher level as well. So the next step, which would start next week, would be experiments on animals, more animals in Thailand. At the same time, the first batch of model vaccine for a human trial would also be produced in other countries like the United States and Canada. If the vaccine experiments are successful and ready for public use, a Thai private company, Bionet Asia, could begin its production after receiving technology transfer from the manufacturers of the model vaccine. And if all goes well, with fingers crossed, some countries around the world, or even Thailand, would become one of the first to have the vaccine in a sufficient amount for the people. Another piece of information mentioned yesterday was a survey conducted wherein the survey interviewed over almost 13,000 adults in 6 ASEAN member states, Indonesia, Malaysia, the Philippines, Singapore, and Thailand, showing remarkable results on this issue, on the issue of preventive measures. It found out that people in Thailand are one of the most active in taking preventive measures, wherein 95% of the Thai people wear face masks always and frequently, making Thailand the highest adopter of the face mask use in the 6 countries in ASEAN. 89% of the Thai people have also used hand sanitizers always and frequently, and 95% have avoided going out in general. 94% have avoided large social gatherings of more than 10 people. This study was conducted by the YouGov company and the Imperial College London. It was found that here in Thailand we have done very, very well so far in curbing the spread of COVID. So we would like to continue to encourage you to keep this in a positive direction and a positive thrust. So in summary, this is all that I have for you for today. In the meantime, of course, you can see from today's statistics that we have to still be reminded that the virus still has the risk of spreading, and there is a real risk if you spend too much time outside your home and if you start to forget all the measures that we have been repeating every single day, because of course we do care. Of course, when you go out, don't forget to use the ituation platform. You have a caricature on screen for you once again. Second phase transitioning step by step, using your mobile phone to check in when you visit establishments using the ituation platform. So, therefore, please continue with your good hygiene routines, your good hygiene practices, and also continue to warn your loved ones to do the same. So, thank you very much. I hope you have a very good afternoon, and please stay safe, and we'll see you again tomorrow. Thank you from the CCSA. ขอบคุณครับ